Hey, everybody. Welcome to the Stop Chasing Pain podcast. I am your host, Dr. Perry, where we strive to have deep and meaningful conversations to make things better. We're back for another Stop Chasing Pain mini podcast. That's where it's just going to be me talking with you for roughly about 15 minutes, sharing some different things that I find very helpful for my own health and the patients that I see in my pain clinic in New Jersey. And hopefully it will be for you in some way, shape, or form, or someone in your life that may be suffering and that you care about. So, what are we going to talk about today? Well, how about this nose breathing stuff? Why it can be beneficial, and what's up with the mouth taping that you're hearing about? I'm going to talk a little bit about that too. Okay. So let's first talk about why breathing through the nose is more optimal than breathing through the mouth. Okay. So it's designed for breathing, right? That's what the nose is for. And of course, you got to smell. Um, but when you breathe in through the nose, in five, four, three, two, one. Welcome, everyone, to the Stop Chasing Pain podcast. I'm your host, Dr. Perry, where we strive to have deep and meaningful conversations to make things better. We're back with another mini podcast episode where I'm going to spend about 15 minutes talking to you about things that I think are pretty useful, pretty cool, have helped me, have helped my clients, and hopefully they'll do the same for you. And today I'm going to speak about why breathing through the nose as opposed to the mouth can be so very helpful. And what's up with the mouth taping stuff that you might be hearing about as well. I'll give you my perspective and share a couple of different things with you along the journey. So let's talk about why breathing through the nose as opposed to the mouth can be so beneficial. To one, your nose is made for breathing, and of course, it's made for smell. But when you breathe in through your nose, a few things happens. It automatically filters toxins more than if you're breathing through your mouth. Why? Because they have all this nasal hair. That's what it's there for. It's supposed to catch things. When your mouth is wide open, well, that doesn't happen. Okay. So it's a toxin filter. Number two, when you breathe in through your nose, you release what's called nitric oxide. And why is that so important? Because it's a vasodilator. Okay. That means it's going to make blood vessels become bigger. Why is that important? Well, the more dilation or expansion that I have in the vasculature, the more oxygen that you can now deliver to the cells in the tissue that actually need it. Okay. And that's the supply chain. That's how you actually get oxygen, nutrients, glucose, hormones, neurotransmitters, all that stuff in your blood. So if you can make a larger pipe, well, that's a check the wind box right there because you can get more stuff to it. But you're also going to dilate the opposite side, which is the venous side. That's the waste side, the drainage side that's going to get the waste products out. And to me, that's even more important because every time your cells use that nutrition and energy that you're delivering to them, they actually create waste through an energetic process. That's what cellular energy is. Anytime you create energy, you make some waste, and that's got to get out. And you want to make sure that those vessels are nice and large to do that. When you breathe in through your mouth, you're not going to increase nitric oxide production. So that's a big reason why you want to go in through the nose. Now, another one is when you breathe in through the nose, you're going to move your diaphragm muscle more efficiently than if you breathe through your mouth. So now the diaphragm is a muscle that's going to sit in the lower part of your rib cage and it sits above your organs, kind of like a parachute that sits over that. And whenever you inhale, that increases pressure in your abdomen. That's called intra-abdominal pressure. And the diaphragm muscle contracts and it pushes downwards towards the organs. And then the organs are pushed down towards the floor and they're caught at the bottom in what they call the pelvic diaphragm or the pelvic floor. That's a hammock on the other side. It's almost like a piston of pressure, if you will. So when you breathe in, you increase pressure, the diaphragm pushes down. And then when you exhale, the diaphragm muscle relaxes, it comes back up, and then the muscles come back up with it. And then that's the pump. So, first of all, that's going to move the organs around, which helps digestion. It's also going to help the blood flow down in the abdomen and also your lymphatic flow, which is your waste management flow, because most of your lymphatic system, which is part of your immune system and your vascular system, actually lives in your abdomen. The majority of it lives inside of your gut. So when you breathe in through the nose, you automatically drive more movement into the diaphragm without thinking about it. When you have your mouth open, that doesn't happen as much, and people are much more likely to use too much musculature and breathing in the neck, and they'll elevate the shoulders up towards the ears, or they'll overuse the lung and what they call the thoracic spine or thorax rib cage more than they will their abdomen, and that's not optimal. Okay. So diaphragm motion is critical for full body function. Going through the nose optimizes that. When you breathe in through the nose, okay, so air goes in and it's going to get filtered and it's going to swirl around by the way that it's designed in there. And that actually increases the pressure of the air. And now the air goes lower down into the lungs. So you get more oxygen to the lower 1/3 of your lungs where you have blood platelets sitting there. Okay. So it's better oxygen optimization. So oxygen can now be taken up into the blood cells and then travel around the body. It also humidifies the air. You can go back into the swirls going up in there and also the nasal hair. It helps keep bacteria at bay in the mouth because if you breathe with your mouth wide open, first of all, stuff's going to go straight in through the mouth hole. You'll likely end up with more dryness around the gums and around the teeth and around the tongue. And then bacteria will thrive in relationship to having dryness in the mouth. That's one of the reasons why you have saliva, is because saliva is a first line defense where you can start to kill things that get inside of your mouth that are trying to kill you, but also you can start to break things down with the enzymes that are in saliva. So mouth breathers have a tendency to be more prone to gingivitis and gum disease because of the dryness in the mouth, the poor circulation of blood flow in there, and then also that dryness. Okay, it's also going to warm the air when it goes in through the nose. Now, tongue position is really important here. Okay, I actually teach a course that's 8 hours long, all about the tongue. That's how important it is. And most people don't even think about the tongue until it hurts, which means they bite into it and they realize that it's there. Let me just tell you this much, though. The tongue is not supposed to stay resting in the bottom of your mouth, especially with your mouth wide open, because if your mouth is wide open, that's the only place it's going to be able to rest, which is in the bottom of your mouth. Your tongue is supposed to be sitting at the roof of your mouth. The tip of the tongue, the middle of the tongue, and the back of the tongue. The whole thing should be up top there. Now, when you do that, the first thing it's going to do is change the alignment of your head and your neck over your torso when your tongue is sitting to the roof of the mouth, and that's going to change your airway. So you're actually going to get better delivery of oxygen down into your lungs when your tongue is at the roof of your mouth as well. And it's going to influence the pressure that resides in the head and the neck and the upper torso, because the diaphragm is going to kind of act like this pressurized hydraulic diaphragm, if you will, because it controls pressure. Now, that's really important because if you have your tongue at the bottom of your mouth and your mouth is open, typically your head is jutted forward. You have more pressure on the back of the head, the upper shoulders, the airway is lengthened, the muscles in the neck get tight, and then you clamp down on blood flow that's going to the head and brain and from the head and brain. And then that can compromise oxygen delivery and oxygenation to the brain. And your brain needs about 20% of the available oxygen in your body and a significant amount of blood flow. So sticking your tongue to the roof of your mouth as you breathe in and out through your nose can be an absolute game changer. And with the tongue at the bottom of the mouth and your jaw wide open, those are the people that usually end up with some TMJ, temporomandibular joint issues, because now you're going to cause tightness and tension in the muscles around the jaw. And then that can compromise blood flow to the outside of the head and going inside of the brain as well. And you get excess tension in those muscles, and tight tissue doesn't accept blood flow well. And then muscles pull on joints. Okay. So then joints become misaligned. So many things can go sideways when you have your mouth wide open. Okay. So I think the big takeaway is uh, breathe in and out through your nose as much as you can, and then put the tongue, the front, the middle, and the back up to the roof of the mouth when you do it. My first assignment that I tell people to do is just start to pay attention to where you're breathing from throughout the day. And I think you'll be pretty startled. I know I was, of how often I'm not breathing through my nose. It's mostly my mouth. Every time I went to check that, I was like, oh my goodness, I'm going in and out through my mouth again. It took me a long time of just awareness and diligence and practice and practice over and over and over. And then the more you do it, the better you will get at it as well. Okay. Because you can't control something until you become aware of it. So the first state is the awareness. Now, what about when you're sleeping at night? Now, I have to tell you, I've lived most of my life as a sleeper with my mouth wide open, and it's caused a whole host of issues for me, not to mention the dryness in the mouth and the gum disease and the periodontal disease, and at least a brain fog and all sorts of crazy things. And I just didn't know what I didn't know. But it's really hard to keep your mouth shut at night when you're asleep, because your body just kind of does what it wants to do. So I actually really significantly benefited from mouth taping, where I just put a piece of tape over my mouth every night, and I still do it. Okay. Some people like me, you may have to do that every night for the rest of your life, because it just is what it is. All right. And I tell my clients to attempt to do this as well. So I'm going to get into this just briefly about mouth taping. And it's just like breathing through the nose. I just want you to type in on Google or YouTube and just look up mouth taping. And you're going to see all different types of tape. You're going to see all different types of suggestions. You're going to people who say do it. You're going to say some people say don't do it. It's going to be all over the map. And this is what I'm going to tell you. It's always like that for everything. Okay. Everything works for someone, but not one thing works for everyone. Okay. But the only way you're going to know is to give it a shot, see if it's helpful for you. And if it works, keep doing it. Okay. If you struggle with it in the beginning, that's normal as well. But if you don't feel that it's right for you, at least maybe at this moment in time, then don't do it. I will tell you this much, though. I would encourage you to start with a strip that's rather small, and usually goes like the picture that you're seeing here. Or if you're not looking at the video here, it's just a single strip of tape that goes vertically up and down, like above the lip, near the nose, down below the lips at the chin. So it's straight up and down. And because if at night, if you need to open your mouth for some way, shape, or form because you feel like you can't breathe, well, goodness gracious, guess what'll happen? You'll open your mouth. All right. So, one, taping your mouth shut at night fosters nose breathing. Right. Now, some people may get anxiety from taping the mouth, especially if you use a big strip of tape. So I caution you to do that, because that's very emotional for people. It can be triggering because some people may have had emotional trauma in the past where they may have been in a place where they felt like they're getting suffocated. Maybe they actually physically were assaulted and suffocated. So I need you to take note when you're doing this. If you feel you're getting that anxiety, then just take the tape off, because I don't want to send you through a fight or flight response, because that's not going to do you any good in relationship to your healing. But I tell people this: if you sleep with your mouth open at night, you will always struggle to get well. You will always have some type of issue, typically a musculoskeletal type pain or issue, or brain fog issue, because you significantly impact the delivery of oxygen to the body and the ratio of carbon dioxide to oxygen in the body, because breathing is more about blood chemistry than just about anything else. But also, when you sleep at night, that's when your brain actually drains its waste products, where your brain actually shrinks up a significant amount by at least a third, if not more. And then it power washes itself through the brain fluid called your cerebrospinal fluid. That's going to be another podcast coming on up. But and then it flushes down into the neck. Now, if you have your mouth wide open like that, you're going to compromise that brain drain. All right. Now, I tell people this: your body is really smart. Okay. So if you've got your mouth taped at night and you feel like you're going to suffocate, your body's pretty good at saying, hey, you might want to wake up here because I'm about ready to suffocate. So you'll wake up. Okay? Now, there's different degrees of what they call sleep apnea, where some people might not benefit from the mouth taping, especially if it's a severe form of sleep apnea. But this is a good time where you can communicate with your doctor about that, or if you're seeing a sleep specialist right here. I'm going to show you a research article here. I'm going to pull on up that I found recently about mouth taping. So let me see if I can find it here. And we'll review this just a little bit. And you'll see this really cool article. It's on via Google search. And this one is on PubMed. It was put out in September 13th of 2022. And it's got several authors in here. I won't try to pronounce their name because I'm sure I'm not going to get it right. But I'm going to list the name of the article. It's the impact of mouth taping in mouth breathers with mild obstructive sleep apnea, a preliminary study. Okay. And I think you'll find it if you just type in the impact of mouth taping PubMed, PubMed, and it'll show up. Let me give you the conclusions here. It says mouth taping during sleep improved snoring and the severity of sleep apnea in mouth breathers with mild obstructive sleep apnea, OSA, um, and being reduced by about half. Okay. The higher the level baseline of dysfunction, the greater the improvement was shown after mouth taping. Mouth taping could be an alternative treatment in patients with mild obstructive sleep apnea before turning to what they call CPAP therapy or surgical intervention. Right. So how cool is that? So it's telling you to give it a go, give it a shot, see if it may make a difference for you. I'm going to speak personally now. It was transformational for my physiology, but more importantly, my brain. One of the things that I suffered with the most when I had some illnesses years ago was full body inflammation and severe and significant brain fog, brain fatigue, and showing early signs of onset dementia. So I knew I had a blood flow problem. I knew I had an oxygen issue, and I knew I had a waste management drainage issue throughout the body and the brain. That's why I'm so big into lymphatics, and I teach the Lymphatic Mojo Body Aquarium courses. And I have the Big Six, BIG, the number six lymphatic reset that you can find that on my YouTube channel, Stop Chasing Pain on YouTube. You can also find it on my website on the homepage of stopchasingpain.com. I would highly encourage you to do that because I always do my big six before I do any type of breathing exercises as well. But oh my goodness, I slept so great. I had more energy, less tired, less fatigue. I do have to tape my mouth shut every single night because it's been ingrained in me for so long that it just wants to open, and it is what it is. Okay. But it might not be that way for you, but I'd like for you to at least attempt it and give it a shot. People always ask, what's the best type of mouth tape? That's going to be kind of practice, see which one you like the best. There's more coming out because people are finding it's very, very beneficial to do it. You've got smaller strips, you've got bigger strips. You can have strips that actually kind of circle around the lips itself. They don't go directly over the lips. You may want to try that actually because it may be a little bit easier for you emotionally and psychologically when you don't have something completely over your lips when you do it. Okay. But try different ones, see which one you like. And I'll tell you this much. I actually tape my mouth when I go for my walks. I tape my mouth when I train on my exercise because you want to breathe in and out through your nose when you're doing that type of physical activity. That's the goal. Now, when you're going hashtag beast mode monster and you're really, really striving, you will probably have to end up opening your mouth to do it. But there's nothing wrong with doing that. But I can tell you that walking with the mouth closed is a game changer as well. And it was difficult for me to do that without taping my mouth, but now I've gotten better at it, so I can do that without opening my mouth as well. Okay. So let's review a little bit. What I would like for you to try is closing your mouth, tip of the tongue, middle of the tongue, back of the tongue, up to the roof of the mouth. Breathe in and out through your nose as much as you can during the day. Monitor how much you're breathing out through your nose or in through your nose or out through the mouth or both. And then tape your mouth shut at night when you sleep. If that's too much for you, you can start to try to do that during the day when you're going for walks or when you're doing physical activity. Just please remember to don't put yourself in a position where you feel like you're going too far and you're getting anxiety from doing it. You just might not be ready for it. And as always, I encourage you to speak with your healthcare provider, whatever that might be, to see what their input is, because everybody's a little bit individual. But this is something that's now on your radar to take a look at. Okay. Thank you so much, everyone, for tuning into the mini podcast. I hope you enjoyed the episode. Thank you so much for tuning in. Don't forget to hit that subscribe button so you never miss a future episode. And please, as we said before, check us out on stopchasingpain.com. This is Dr. Perry signing off. We'll see you on the next episode. Take care.